Today we're going to talk about the cardiovascular system, specifically blood. I'm Mark Van Cura. I'm going to give you a quick lecture, I would say overview of blood. This is Marco Rabazo on your top screen. He's an editor and videographer, and he will help edit and put all this together. Let's start out with, again, the cardiovascular system. Of course, when you think cardiovascular is heart and vessels, and today we're actually going to talk about the blood. And everybody, of course, knows the word blood, and I say, well, blood really is made of what are called the three formed elements. And of course, the three formed elements are going to be one RBC, a red blood cell. The second one is a WBC, or a white blood cell. And the third one is going to be a platelet. And of course, a platelet is going to be a clotting cell. So just remember those three terms right now. Now, I'm thinking you're going to say to yourself, well, where did these things come from? And I know when you may have studied bones in that, you talked about cancellous or spongy bone. And when you talked about cancellous or spongy bone, you may recall that you may have seen a diagram or you read about it. You had a long bone, and there was over here was something called the epiphysis, or the end, the diaphysis, or the shaft, and then in this region here, we had what was called some spongy bone, or cancellous bone. And inside of these tubules that we had, they're called trabeculae. Again, just refreshing your recollection. Trabeculae, which are tubules. Those trabeculae contained red marrow. And remember, red marrow equals myeloid tissue. And it's that myeloid tissue that's found in that red marrow that we're going to produce all of our formed elements, our red blood cells, our white blood cells, and our platelets. So don't get confused when someone says the word red marrow and thinking that's only responsible for the production of red blood cells. Let's take a look at each of these formed elements here. Let's start out with the red blood cell. So the first formed element is the RBC. We already said that's a red blood cell, which is called an erythrocyte. You want to remember that erythrocyte just means erythro, which is red, cyte, which is cell, so a red cell. We're going to remember that the number one function of a red blood cell is going to be to carry oxygen. We know that a red blood cell is going to contain hemoglobin, or HGB. And that hemoglobin is going to be the carrier for the oxygen to bring it to my cells, to perfuse my cells with oxygen. A red blood cell is going to be described as a anucleate, biconcave disc. So therefore, if I was to draw it, I could draw it kind of look like this. There's two cavities, biconcave. Or I could draw it like this and see that the inside is kind of depressed because I've lost my nucleus. But either way, it's looking at a normal red blood cell. We're going to use a size. The normal size is going to be 7.5 microns in diameter. And remember, it lost its nucleus when it matured. So as a red blood cell is maturing, it starts out from a cell with a nucleus, but as it matures, it replaces that with hemoglobin so it can carry oxygen. So there's two terms before we move on from that, and that's something called the monophyletic theory. And even though this is something that's been talked about for years, they still use the word theory. Theory monophyletic means that it's one stem cell produces all the formed elements. So one stem cell produces red blood cells, white blood cells, and platelets. That's the one that's accepted as to how blood is formed. Another theory that used to be propounded but isn't said much anymore, but you may find it on exam somewhere down the road for board exams or the like, it's something called the polyphyletic theory. Polyphyletic theory was basically you had a stem cell for each line. So therefore there was a stem cell for a red blood cell, there was a stem cell for a white blood cell, there was a stem cell for a platelet. But if we use this monophyletic theory as the right answer, we're going to remember that in the monophyletic theory, it's going to say that that stem cell in the monophyletic theory is called the CFUS. It just comes from the research paper that was done years ago, and therefore that got the term of colony forming unit spleen. Because if you were to study embryology or the developing fetus, you know that we have our yolk sac that eventually goes to the spleen, and the spleen then goes to the marrow, and therefore the early precursors of our production of all of our cells actually comes from the spleen itself. And so the spleen is another topic for another day. So now we know that we've got the theories of how it's formed. So we talked about a red blood cell. Again, remember it's an anucleate biconcave disc. It's got a 7.5 microns in diameter. It's lost its nucleus when it matured. Its number one function is to carry oxygen. And of course, we can have different looking red blood cells which are basically causing a type of anemia. So I'm just going to go through a couple quick ones here. And one that you're very familiar is something called sickle cell anemia. Well, a sickle cell anemia means that red blood cell, if this is a normal red blood cell appearing, so this is normal. If I have sickle cell anemia, it really equals deformed hemoglobin. So instead of that looking like this, that red blood cell looks like this. And if you can imagine, if that's sickle cell and that's a normal, it's never going to be able to exchange oxygen, because remember, a red blood cell has to pass through a capillary. Well, if this is a normal red blood cell passing through here, it's going to very easily touch up against the wall, and it's going to be able to send oxygen away and pick up, CO2 as it's passing by a cell. But if I've got a sickle cell here, it doesn't really touch the wall. I'm not really going to be able to get oxygen away, and I'm not going to be able to get that CO2 back in to carry away that product. Just remember, O2 is going to be called the nutrient, and CO2 is going to be called the waste. And so I always tell students the way you're going to remember this is the example is the 13-year-old, and I'm going to say it's a black child. Why do I say that? Is because 8 to 10% of the black population theoretically are sickle cell carriers. That doesn't mean that only black people have sickle cell trait. There's a lot of different races that have the sickle cell trait, but they have the highest incidence of it. And basically, if you think of the 13-year-old black child, and he goes in and he says, "Mom, I want to play basketball," and he goes in for his physical. And the doctor looks at him and he says, "Boy, you look very healthy." So the doctor signs the release for him to play basketball. And he goes the next day and plays basketball and comes home and says, "Mom, my joints hurt." So signs the release, goes out and plays full court basketball all day, comes home and said, "Mom, my joints hurt." Back to the doctor. The doctor says, "That's growing pains." Next day he goes back to school, plays basketball, sudden cardiac death. So back to school, we're playing basketball again, and he has a sudden cardiac death. And the question is, what happened to him? Well, what happened to him is no one tried to put the pieces together and thinking that the reason this 13-year-old boy was actually having joint pains was because he had sickle cell anemia and he was not exchanging gases properly. And the first way that comes about is that strange pain in your joints, almost like an arthritis in an elderly or an injured person, and just like the pain of a heart attack. And so since the child's got a heart, because the heart is the number one organ to use oxygen, the child suffered a massive myocardial infarction, sudden cardiac death, and died. So that's how you're going to think of the significance of sickle cell trait. And of course, the other thing you should remember that there are a lot of different types of anemias. So the other anemia I would think you'd want to remember is going to be called pernicious anemia. Pernicious anemia is generally going to be a female disorder. It's going to be from a decreased B12, and therefore another significant pathology to remember is pernicious anemia. I always think of pernicious anemia, a way to remember it is that probably a lot of you are familiar with something called a proton pump inhibitor. And the best example of that, or a PPI, is the old word called Nexium. Some of you may see it over the counter now as a Meprazole. What Nexium is a PPI, or a proton pump inhibitor. Well, the proton pumps, one thing that they do is the cells inside of my stomach, they actually produce intrinsic factors. So when I take a proton pump inhibitor for reflux and that, it actually works on the cells of the parietal cells of the stomach. So just remember, inside of the stomach, I've got parietal cells. Parietal cells will produce hydrochloric acid, and they also produce intrinsic factor. Well, I know that when I take omeprazole or Nexium, it's going to block my acid production. It's going to heal my ulcer. Sounds great. But at the same time, it's also going to cause these parietal cells to stop producing intrinsic factor. Intrinsic factor is necessary for the absorption of B12, so that helps me absorb B12. I need B12 for red blood cell production, so therefore when anyone takes long-term omeprazole or Nexium, especially a female because they're anemic by their very nature, I have to realize that when I block my intrinsic factor, I block my absorption of B12, and that's going to lead to an induced pernicious anemia. So just remember, this is an induced pernicious anemia, and the reason it's induced by the use of a medication. So again, big picture, how do you remember things? That's how you remember red blood cells. The other one would be a folate deficiency anemia, and just remember folate is folic acid, so the other one I want you to remember is a folate anemia. And the same thing, that's from a decreased folic acid intake. That's one of they call the prenatal vitamins. And if you were to study bones, you'd see that's the reason sometimes children are born with the skull didn't completely come together, or some type of cleft palate, cleft lip issues. But just remember folate anemia and think of pernicious anemia. The other thing we want to think of the numbers we've got. So, and we're talking about red blood cells. Remember that in the body we've got two different numbers. One is going to be what I call the male range. So the red blood cell range is going to be in a male, it's going to be 4.5 to 6 million per cubic millimeter. That's a normal range. In a female, because I said earlier that they have basically a little bit anemic by their very nature, they're about 3.7 to 5.5 million per cubic millimeter. So key terms here to remember: 7.5 micron diameter, 4.5 to 6 million male, 3.7 to 5.5 female, pernicious, folate anemia, and then where these red blood cells are produced in their anucleate biconcave discs. Then we move on to the second formed element, and that's going to be a WBC, or a white blood cell. Remember, a white blood cell is going to be a leukocyte. Leukocyte is a white blood cell, leuko-white cyte cell. Let's think about leukocytes, because again, we're going back to that monophyletic theory. That's a stem cell sitting inside that myeloid tissue. The difference here being that leukocytes are going to have two main classifications. There's going to be granulocytes and agranulocytes. Granulocytes means there's granules in the cytoplasm. A means no granules in the cytoplasm. First of all, let's do the granulocytes. We're going to have a basophil. Basophil means it loves a basic stain. That's where it got its name. We're going to remember a basophil is going to be also called a mast cell when it's extravascular. We're also going to remember that basophil is going to produce 3 prostaglandins. Produces 3 prostaglandins. Prostaglandin is a localized hormone. That's going to be heparin, histamine, and serotonin. Heparin, anticoagulant; histamine, inflammation; serotonin, just think of serotonin is going to be a chemical messenger. When you think of an SSRI like Prozac, a selective serotonin reuptake inhibitor. So that's my one, basophil. What's the second of the granulocytes? Well, that's going to be an eosinophil. An eosinophil is also called an acidophil. That means it loves an acid stain. So years ago when they came up and looked at these, because it picked up an acid stain and stained, therefore it got its name. You're going to remember that eosinophil is going to be elevated in parasite infections. So in parasitic infections, you're going to have an elevated eosinophil count. It's also going to contain some immunoglobulins are going to be inside of it. So basophil, eosinophil, and then of course the third one in that lineage is going to be a neutrophil. That's going to be the most common of the white blood cells. You know, when we're talking about white blood cells, remember we said red blood cells are 4.5 to 6 million? My total white cell count, we're going to remember, is going to be somewhere around 6 to 10,000 per cubic millimeter. So therefore, just think of the number difference between 4.5 to 6 million versus 6 to 10,000. So there's the most numerous formed element naturally is the red blood cell. But now we're looking at these white cells and we come down to the neutrophil, and we know that the neutrophil is the most common WBC, white blood cell. Well, a neutrophil is always going to remember the first cell at the site of infection. So whenever you cut yourself, those are the ones that are going to run over to that infection. Those are the ones that are actually going to form that purulent exudate called pus once they've done their work. So kind of think that the pus that comes out is nothing more than dead neutrophils. You also remember that a neutrophil has got another name for it. It's called a polymorphonuclear leukocyte. And therefore, a polymorphonuclear leukocyte is called a PMNL. Poly means many. Morpho, form. Nuclear is your nucleus, and a leukocyte is a white blood cell. So when I look under a microscope at a neutrophil, all of them are going to look different. So when I look under the microscope at these neutrophils, I'm going to see that, I could have one sitting up here that looks like this, and here's the nucleus inside of it. And that would be a PMNL. These are granulocytes around it. But I could have one sitting right alongside of it, and it looks something like this. And that's the nucleus. But it looks different. So again, the nucleus will always look different. That's your distinction of the two, okay? Basophils, you're going to look at something where it's going to have kind of like barbells kind of running between it. So kind of think something like that, how the nucleus is sitting inside of it. And then, of course, the eosinophils are going to be very similar to that, but they're just going to have this red dye. So just remember, it's still going to have that kind of a barbell appearance, but acidophil is going to have red granules. So remember, that's going to be red blood cells, white blood cells, and platelets. Now, we've just talked about the granulocytes, so now we've got to take a look at that other line up here called the agranulocytes. So since we've covered the granulocytes, let's take a look at the agranulocytes. The agranulocytes, remember, no granules in the cytoplasm. Even though that's what they're called, they really do have granules, except they don't stain. So they're going to call them no granules, but just remember, you may have a test somewhere down the road and you could be tricked by it because they say, well, there's no granules. Well, actually there are, they just don't pick up the stain. But the agranulocytes are going to be broken down into two lines, and that's going to be the lymphocytes and the monocytes. Well, let's see. Lymphocytes are going to be either going to be large or small. So when you look under a microscope, they're going to be very large cells or very small cells. When I look under a microscope at a lymphocyte, I can always tell it's a lymphocyte whether it's large or small. So it was either this or like this, because basically the whole thing is going to have this big nucleus. It's going to be all nucleus. And it's going to have what's called a ring of cytoplasm. So it's the giveaway. But now I've got to take that lymphocyte and break it down into either B cells or T cells. Well, let's see. B cells, I'm going to have a memory B, and I'm going to have a plasma B. Okay, so those are our two. Remember, memory, it's going to remember a prior exposure to something. Plasma just means it's the one that's going to be running around in my circulation. The other type of course, is the T cells. T cells are going to be 4 different types. You're going to have the helper T, the killer T, the suppressor T, and the memory T. Helper T cells, significance, also called a CD4 cell. Significance of that, that's how we determine AIDS. So AIDS is determined by the Center for Disease Control years ago by the number of less than 200 per cubic millimeter. So therefore, once your CD4 helper T cell is below 200, you now determine you not just have HIV, but it's now developed into AIDS, acquired immune deficiency syndrome. Killer T cells, just by the name, they automatically kill because they're kind of cytotoxic. The next one that is significant here is our memory T. How do I think of that? Because your memory T cells, I'm going to think of the bee sting. So if you ever think about the bee sting, you're going to think, well, 3 years ago I was walking to school and I got a bee sting, had a little bit of anaphylaxis, a little bit of tightness in my throat, went to the emergency room. They may have given me a Solu-Medrol injection or maybe some epinephrine and said, Mark, next time you get a bee sting, it could kill you because the secondary response is much quicker, more virulent. They said, here's a prescription for an EpiPen. Today I was on my way to give this lecture. I was stung by a bee. My body remembered that bee sting. I had now my secondary response. I went to look for my EpiPen. I never filled the prescription, and I died of anaphylaxis. So therefore, my body remembers prior exposures. Suppressor T cells are very important because those are what we're going to look at when we start talking about autoimmune disorders. Remember, autoimmune means self, which is my own body, recognizes self, my own body, as non-self. It's recognizing my cells as someone else's cells, and it's going to attack them. So therefore, the suppressor T cell is a great differential to determine whether someone, for example, had irritable bowel syndrome or they had Crohn's disease. So if we just remember this little story, it's a good way to keep in mind of the significance of autoimmune disorders as well as the idea of suppressor T cells. So just think that when I use the word autoimmune disorders, I think great examples would be Crohn's disease, MS or multiple sclerosis, RA or rheumatoid arthritis, or lupus, which is sometimes abbreviated, we're called SLE, or systemic lupus erythematosus. And I could go on and on at different autoimmune disorders. Remember, my body is recognizing my own cells as someone else's cells, and therefore it's attacking them or killing them. And so I gave you the example, and I said a person had a question, they had this rectal bleeding, they constantly had abdominal pain. The question was it IBS, was it irritable bowel syndrome versus Crohn's disease? And what would be the way to determine that? I've had 10 colonoscopies. They keep saying, it could be irritable bowel, it could be Crohn's. The symptoms and signs are very similar. I would just have to look at the suppressor T cell count differential. So just remember, suppressor T cell count. Will the suppressor T cell count suppress my immune system? So the function of a suppressor T cell is to suppress my immune system. So therefore, if I've got an autoimmune disorder, do I tend to suppress my immune system or do I tend to activate it? I tend to have a very activated immune system. So I could differentiate very quickly and say, well, I took your suppressor T cell count and your suppressor T cell count was elevated. If it was have an elevated suppressor T cell count, obviously I've got irritable bowel syndrome. So if I've got an elevated suppressor T, that would tell me it's more likely irritable bowel syndrome because my body suppresses my T cell immunity. Crohn's disease is not going to be elevated whatsoever. It might even be depressed. So in this, it's either going to be the normal or down. So it's going to be a lowered. So that's the way you're going to look at basically that idea of this autoimmunity and how we're going to look at the 4 types of T cells. That leads us then over here to the second lineage of agranulocytes called a monocyte. So remember, monocyte, a monocyte is going to be the largest of the formed elements, or the largest white blood cell. Sometimes you'll see them as large as 28 microns in diameter. And when I look at a monocyte under a microscope, and I said, how would I differentiate that from a lymphocyte? Remember I said a lymphocyte had that ring of cytoplasm? But when I look under a microscope at a monocyte, it's going to have this really big nucleus, except it's going to be indented. And sometimes you'll see it's called a indented or horseshoe nucleus. So indented or horseshoe shaped. And therefore that's going to tell me I'm looking at a monocyte. Of course, it's very, very large. Remember, a monocyte is going to be significant because a monocyte is going to be a monocyte when it's intravascular. So monocyte equals a monocyte when it's intravascular, when it's inside the vessel. But when it leaves the vessel, a monocyte equals a macrophage when it's extravascular. It changes names. macro giant, phage eater, a giant eating cell. And it's that monocyte or macrophage that once it became extravascular, that's going to become either a couple specialized kind of macrophages. In the central nervous system, I've got a specialized monocyte called a microglia. That's because I do not have any lymph nodes in my central nervous system. I've got another one in the GI or gastrointestinal or digestive tract called a Kupffer cell. And I've got another one that's very significant in the respiratory tract. And that's called an alveolar macrophage. An alveolar macrophage is called a type 3 pneumocyte. And a type 3 pneumocyte is also called a dust cell. So therefore, that's going to clean your airways as it works its way through. So now we've gone through the red blood cells. We've talked about the white blood cells. We differentiated the granulocytes and the agranulocytes. And that only leaves us one more, and that's going to be our platelets. Remember, platelets are going to be called thrombocytes. Thrombocytes are clotting cells, clotting cell thrombocyte. It's going to be an amorphic granule. So it has no structure or form. So if this is a red blood cell sitting right here, and this is a lymphocyte, for example, sitting next to it, this little speck here that you may think is because the guy didn't clean the microscope, that is going to be an amorphic granule called a platelet or thrombocyte. You're going to remember a platelet is going to have a range now to remember about 125 to 250,000 per cubic millimeter. Okay, so platelet or thrombocyte. I would remember something, a disease that people get called DIC. DIC is disseminated intravascular coagulopathy. Well, disseminated means to spread. Intravascular, within a vessel. A pathology or disease of coagulation. So oftentimes an example of that would be, I needed a blood transfusion. My body rejected your blood, was able to work with it. It would cause my body to throw out this platelet shower and literally plug up my microcirculation, leading to renal failure and failure of any of the microcirculation, amputations, and death. Finally, I think the thing we want to just address here, so we've got, remember, the three formed elements: white blood cells, red blood cells, and platelets. We talked a little bit about some of the pathologies that we would have of this, and that basically, I would say, covers the formed elements and cells, or all the cells that are found in the cardiovascular system. Well, thank you, and we will move on next time probably to the either circulation or the heart. Have a great day.